intracranial bleeding. In that we subclassify into three. One is subarachnoid. Second one is subdural. Third one is epidural. As we know already, so brain cells. After that we have three layers. First layer is pia mater, second layer is arachnoid mater, third layer is dura mater, right? So this is pia mater, this is arachnoid mater, this is dura mater, right? If any injury or bleeding happens, inside pia mater, the first layer inside pia mater, that is called hemorrhagic stroke. Hemorrhagic stroke. Right? So in that way, the vessels which are supplying the brain already, that means the anterior cerebral artery, posterior cerebral artery, inferior cerebral artery, superior cerebral artery, all these arteries. When any of these arteries are going for hemorrhage, it will affect focally which are the areas it is actually supplied. That is hemorrhagic stroke. Then the next one, we are seeing what is happening when there is any hemorrhage just below or inside pia mater. Now, just outside the pia mater, what we are having, the next layer is arachnoid mater. So, in between the pia mater and arachnoid mater, we have, what is this? Subarachnoid space. Subarachnoid space. In that subarachnoid space only we have CSF and all the important blood vessels like circle of Venus that is present inside the subarachnoid matter. Subarachnoid space, CSF, it is floating actually, right? If there is any injury or trauma over there, we have a hemorrhage, and that hemorrhage inside the subarachnoid space is called subarachnoid hemorrhage. Right? Now, what will happen in the subarachnoid hemorrhage? And sometimes the hemorrhage may happen just above the arachnoid mater also. Above the arachnoid mater, we already have dura mater, right? So, the hemorrhage will be just above the arachnoid mater and below the dura mater. That means in between the arachnoid and the dura mater. That space is called subdural space. Subdural space. So when there is any hemorrhage in between dura mater and arachnoid mater, it is called subdural hemorrhage. Actually speaking, here I want to clear one thing. We cannot say simply that is hemorrhage, because there is some difference between hemorrhage and hematoma. See, we have certain areas to be covered in subarachnoid space. We have CSF and we have large amount of loose cells are present inside the CSF. So there is a large amount of area to be covered. So the hemorrhage may mix with the CSF and it will free flow to all the areas. So we can say that is hemorrhage. But here we can say it is hematoma because it is accumulated or it is concentrated to one particular area. One or two particular areas it will be concentrated. So we have to say that is hematoma, not hemorrhage. We cannot logically say hemorrhage. It is hematoma actually, right? So that one is hematoma. The same way, if there is sometimes the bleeding may be occurring just above the dura mater also. Above the dura mater we are having, what is this? Cranium. It means the bone which is covering here, right? So in between this space, in between the dura mater and the bone, right? There may be sometimes hematoma. That hematoma is called as epidural hematoma, right? And above that bone we are having aponeurosis and skin, superficial fascia, skin, hair, and loose structures, right? Okay.